Agency trying to crack down on medical cannabis being sold here in Georgia, despite, of course, state law recently allowing it.
11 Alive's Paolo Suro spoke to a pharmacist today who says this could all have repercussions on many here in Georgia.
Ira Katz with Little Five Points Pharmacy in Northeast Atlanta says he got an email from the Drug Enforcement Administration last week and a written notice today.
In the notice, the DEA's Diversion Control Division is notifying pharmacies across the state that they could be violating federal law if they have or sell medical cannabis, as it remains a Schedule I drug. Georgia recently became the first state allowing pharmacies to sell it. Katz, who believes this could help fight the opioid epidemic, lobbied for the sale of medical cannabis in pharmacies and thinks it should be reclassified and allowed in independent pharmacies like his.
We're the most regulated industry in healthcare. We really are. That's what shocks me. That's what blows me away when it comes to why the DEA is not moving on this, and they don't see what we see here every single day.
We've reached out to the DEA and the Georgia Pharmacy Association, but have not heard back yet. Meanwhile, Michael Mumper with Georgians for Responsible Marijuana Policy welcomes this crackdown.
There was always that tension about where is the federal government going to draw the line. Where Georgia went the furthest is that they were the first state in the country to have pharmacies dispense medical marijuana. And so that I think they just pushed the DEA to a certain point.
Katz says he understands federal law trumps state law, but believes that at the end of the day, this crackdown will end up hurting people who rely on medical cannabis. More on what he has to say coming up at 5. Paolo Suro, 11 Alive News.